go ahead and get started. Let me introduce myself. My name is Marin. I'm a co-founder of a company called Age Well, Live Young. And what we do is we provide education, tools, and support to help people age well and live young. And it's based on 3 core components of exercise, nutrition, and social interaction. And we are currently piloting the Ollie platform to test some of our key concepts, and a lot of the faces here are very familiar to me. And one of the concepts we wanted to pilot was to provide education around some of the key components of exercise, one of those being neuromotor. It's actually prescribed by the American College of Sports Medicine as one of the most important things you can do as you get older to work on your balance and agility. And as we came up with Ollie, I thought, who in Mill Valley could I have teach a course to really help people understand and know how to do this? Cindy was my physical therapist years ago, and she came unbelievably highly recommended by many people. My doctor said, if you can get into her, get into her. And my experience with her was wonderful. So when this came about, I wanted to see if Cindy was willing and open to doing this, and I'm very excited that she's here. So I'm actually going to turn it over to Cindy to drive the show.
Thanks, Bree. Hello. For those of you who don't know me, I'm Cindy Dehan, and I'm the owner of a practice called Marin Physical Therapy, which is located just around the corner near 7-Eleven on Miller. And Bree contacted me about a month or 2 ago and asked if I could be part of their group, which sounds great. So we decided that balance would be a really good topic because it affects everyone. And certainly as we age, we notice it more or become injured. So today I wanted to talk about balance, and we'll do a little bit of talking first, kind of looking at the factors that go into balance, the different systems that are involved and can become impaired, and some of the risk factors, which you may know some of them, but I was actually surprised when I was researching some of them, some of the things that can play into it that you wouldn't necessarily think about. And then we'll go through some tests of how you can test to see where you are for your balance and see where you are for your age. And then lastly, we'll go through some exercises that are geared towards balance. And I wasn't quite sure what the population would be, so I tried to make exercises that were all ranges. So if you find some of these look really scary, don't do them yet until you get better. And if some look boring, then there's always ways of making them harder. So we'll do that at the end, and then I'll be open to any questions that anybody has. So balance is, as defined by Wikipedia, is a complex process involving the reception and integration of sensory inputs and the planning and execution of movements that allow us to stand upright. And many factors go into balance. Primarily, there are 3 systems. And the 3 systems include the vestibular system, which is your inner ear. And in our inner ear, we have little hairs with little stones on them. And these little stones, as you move, the sound waves go into your ear, and it sort of tells your brain where you are in space if they're working properly. And that also works with your vision, so that's the other major system that is part of balance. And then lastly, there's the system called the proprioception. And proprioceptors are little sensory receptors located in your tendons and your joints and your ligaments. And they kind of sense small fluctuations in position, and they tell your brain where you are. And sometimes with something as simple as an ankle sprain, you can, kind of forget where you are in space. And I'm amazed because I see people of all ages in my clinic, and we get kids as young as elementary school that you go to stand on one foot and they practically fall over. And so those are things that really you want to retrain. Unfortunately, kids are out running around and out on the playground, so typically you're pretty good at retraining them. But for the rest of us, as we get older and work in jobs or maybe more sedentary, it doesn't always come back quite as fast. some of the facts about aging that I found really amazing is that for people over 65, 1 in 3 people fall each year, and for many different reasons, but I thought that was a huge percentage. 75% of all emergency room visits are fall related, and 40% of hospital admissions in people over the age of 75 are the result of a fall. And then falls are the leading cause of death from injury in people over the age of 65, in people over the age of 65. So those are pretty startling numbers, and of course it may not be the fall itself, but you fall and then you break your hip and then you're in the hospital and then you get MRSA and then, so one thing leads to another. So really the best thing you can do is look at the factors that may be contributing it, and if you know your vision is changing or you know you have an inner ear problem, you need to go to the appropriate doctor or therapist and get these things addressed. The good news is that many of the balance system is very adaptable, and your brain is amazing and plastic, and it can really learn. So even if you have these imbalances, it's amazing. And I've worked with people who've had brain tumors or some pretty severe neurologic problems, and it's amazing what you can retrain. So that's the good news. So, so I mentioned these 3 systems, all of them deteriorate with age. And strength and flexibility are ones that we address in physical therapy, and ones you can address through the gym or through different types of exercise that are very, you can really improve upon. So the treatment strategy is basically use it or lose it. So with the treatment and if you know you have a balance problem, or even you are feeling slightly less steady than you used to feel, you really want to spend 5 to 10 minutes a day just focused on balance. And some of it is as simple as, you're in the grocery store line waiting, just getting on one foot, assuming you're safe, and standing there, and you can integrate it just into daily activities, so it doesn't have to be enormously time consuming. So I have a handout here now. If you look to the page that says risk factors and standardized balance tests. So the risk factors, there are many risk factors, but there is a University of Chicago has done some really good research on falls, and they've tried to rank the top reasons why people fall. And this list is what they consider to be the top 8 reasons. So the first and most important one that they indicated the number 1 risk factor was lower extremity weakness. 50% of people over the age of 50 cannot get out of their chair without using their hands. So that's a pretty surprising number. And Marin, we are probably filled with the healthiest older people anywhere. So that may not be, this particular crowd it may not be as true for, but it's it's something that strength and muscle mass also diminish with age. History of falls, gait or balance deficits, arthritis, impaired cognition, depression, visual deficits, and age over 80. These are all considered risk factors for falls. Also, medications can affect balance, as probably many of you know. And I've listed some of the more common ones that you might consider if you're noticing your balance being off. And this includes antidepressants, a lot of the pain meds, even aspirin, and some of the non-steroidal anti-inflammatories that we take just like candy. People don't think of that as a balance inhibitor, but for some people they can be. The anti-anxiety drugs, antihistamines, just over-the-counter antihistamines, blood pressure and other heart medications, and sleep aids, so some of them over-the-counter. These can all affect your balance. And fortunately, I'm seeing more of a trend where doctors don't automatically prescribe blood pressure for everyone who's got slightly high blood pressure. And I've had a couple of my patients say, oh, they don't want me to go on it, I'm afraid of the balance implications. So that's, good to see, because, a lot of these things are treatable in other ways besides medication, depending on the severity. So So I wanted to do just a quick test. There are many balance tests out there, and there are ones, there's a more lengthy test called the Berg scale, which is probably the one most commonly used in rehab centers. And that's a really lengthy test, so I didn't really want to do it here. But I thought we could all stand up and do one of these quick tests, just to give yourselves a general idea of where we fall for our age. So I'm just going to get my timer out. Now, if anyone's afraid of falling, or they think they might, it would be terrible to have a balance class where people fell. So if you want to stand with your chair in front of you, that might not be a bad idea. Some of these things are they may be harder than it looks when you're, or if you want to stand by one of those bars on the wall, you can feel free to do that too. Okay, I'm going to get my timer out here. Okay, so let's go, we're going to go ahead and do what they call the single limb stance test. So all you're going to do there is just going to, actually, before you get started, we're just going to stand on one leg. Don't do it yet. Oh, you can practice, that's okay, you can practice. We're not timing yet, I got to get my timer ready. Okay, so on the count of 3, you're going to just stand on one foot. Let's go with our right foot first, and we'll count.
Eyes closed or open?
Eyes open first. Okay. Then we're going to go closed, and actually the test is really standardized based on eyes closed, but I just want to get a sense of how everyone's balance is first. So, ready? 1, 2, 3, balance. So, with balance, the strategies are hip and ankle. Those are the primary joints that that we use with balance. And it's interesting, if you look, they've done biomechanical analysis where they put electrodes on children's hips and ankles, and they've done it through every age group. And children, when they first, start learning how to walk and balance, they use a lot of their ankles. It's really primarily through their ankles that they balance. And then as they get older, it becomes more what we call a hip strategy, and it becomes much more hip focused. And that goes through your 50s, but then as you get through your 50s, it starts going back similar to the way it was as you're younger, and it goes more to an ankle strategy. But if you're looking for strengthening exercises, the hip and the ankles, those are 2 big areas you want to really keep strong. So I'm going to start with a warm-up, and we're just going to do, and don't worry if this isn't exactly in order, they're all on here, but we're just going to do heel-to-toe raises. So you're just going to rock back, lifting up your toes, and again, feel free to use your chair if you need it, or hands on both parts of the chair, or if you're sitting, you can do the same thing sitting. So what we're doing here is we're waking up our proprioceptors, those little sensors. And this is something I'm always amazed if I have someone whose balance is really off. We'll go doing about 30 of these, and then we'll go back and retest it, the balance, and it's 95% of the time much better. Okay, so next we're going to do, it's called tandem standing. So you're just going to put one foot in front of the other one, like you're doing a driving while intoxicated test. Heel-to-toe walking, and actually heel-to-toe walking is a really great balance exercise. So you're standing there, and this may feel really easy compared to the others. If it does, now try closing your eyes again with one foot in front and see how you are. Okay. So now we're going to go over to the back page, which is hip, I call it hip 4-way. And you can, if you want, they have these bars over here, you're welcome to use that. I think there's enough room if you make sure your chair is not too close to the next person's chair. This is about hip strengthening. So what you're going to do is, let's have everybody turn this way, and make sure you're not going to kick your neighbor. So you might space out the chairs a little bit, or if you don't need a chair, you can. Good. Okay. And we're going to start standing. Let's go onto your left leg. The right leg is just going to go forwards. So you're trying to keep your body upright and trying to use that front quadricep muscle and the hip flexor, and then bring it back down. Oh, you're doing pretty good. And again, lifting the legs straight up. And hold for, if you can do it for 5 seconds. And then back down. Okay, now the next direction is sideways, and this is what I think is probably the most important muscle of your hip, which is your glute medius, kind of your outer rear end muscle, sort of like the rotator cuff of your hip. So you're just going to reach it out to the side, and you'll feel a little something in here, and then bring it back down. Good. And I'm trying, again, not to use my back, which as you see as I'm doing this, I'm using my side. That's how we're trying not to do it. So try to keep your trunk elongated. You can even draw your belly button into your spine a bit. And then you're initiating from your hip, sort of like a speed skater, and you're bringing it out. And you won't be able to go very high if you're just using your hip. I mean, if you're a dancer, you might, oh, you have good now, that's pretty good. This is about as far as I can go, so it's not that far. Good. Back down. Good. And one more time, over right leg, lift. To do a chair squat, and this is nice because you can do this, you can do 5 of these going to the, before you sit down for the toilet, or before you sit down for dinner, you can do 5. And it's kind of like you make a little rule for yourself every time, right when I sit, I'm going to do 3 to 5. Can really be good exercise. So everyone slide forward a little bit so you're towards the front of your chair, and that's going to make it a lot easier. And your feet should be kind of back beneath your knees. And you're going to transfer your weight forwards. Now these chairs, like I said, aren't good. And might also be armrests, so you can use them if you need them. But you can put your hands on your legs if you feel like you need it. You're getting your weight forward, and then you're just going to stand up.